The webinar will start shortly. Thank you for being on the call. Thank you for joining today's webinar. I'm Ferris Taylor, Executive Director of the Healthcare Executive Group. Today's presentation is led by one of our longstanding HCG sponsor partners, HealthEdge, and it's titled The New Engaged Digital Consumer, What Digital Healthcare Organizations Must Do to Survive. Welcome and thank you for participating. Next slide, Ed. Quickly about HCG, we are a national network of healthcare executives and industry leaders celebrating our 30th anniversary and working together to reshape healthcare. We interact regularly across multiple channels, such as these webinars, periodic executive roundtables, white papers, social media, blogs, newsletters, and our annual forum. By facilitating these frequent interactions, we provide a platform for networking and industry-leading discussions. You can learn more about how we convene and support healthcare executives at hcg.org. Next slide. Throughout the year, culminating in our HCG annual forum, our members discuss and debate critical technology challenges and innovation issues and priorities. We then formally vote the HCG Top 10 list for the next year. Today's webinar will focus on several HCG 2019 Top 10 issues, including number 2, as you see, the total consumer health, and number 5, the digital healthcare organization. These issues are at the very fabric and infrastructure change at the core of the dramatic transformation taking place in healthcare, consumerism supported by digital technology. To facilitate today's webinar, let me turn the webinar over to Ed Burke at HealthEdge.
Thank you, Ferris. My name is Ed Burke, and I'm Senior Manager of Marketing here at HealthEdge, and I will be moderator for today's webinar. Before we begin, I'd like to review a few quick housekeeping items. First, questions. Please send us your questions at any time during the broadcast using the questions panel on the side of your screen. During the broadcast, all attendees will be muted, but we will continuously monitor the questions panel and answer your questions at the end of the webinar. Second, technical difficulties. If you experience technical difficulties during the broadcast, we suggest that you log out and then return to the webinar, as this typically resolves most connection issues. If you encounter persistent technical difficulties, you can contact GoToWebinar technical support. And finally, the recording. This broadcast is being recorded and will be made available to you after the webinar. Well, that concludes the housekeeping items. Let's get started. Now it's my pleasure to introduce our panelist, Harry Merkin, Vice President of Marketing at HealthEdge. Harry has worked with both payers and providers through many dynamic changes in healthcare and currently leads marketing at HealthEdge, including product marketing, demand generation, and thought leadership. Over to you, Harry.
Thank you, Ed, and thank you, Ferris, for your gracious welcome. Next slide, Ed. Thank you. Just a brief introduction. You heard a little bit about me. Just a quick snapshot of HealthEdge for everyone's edification. We've been around for about a dozen years. We serve the payer marketplace. We've got customers that span the complete spectrum of different kinds of health insurance plans. across all lines of business, large and small, regional, nationals. We announced Blue Cross Blue Shield of Nebraska earlier this year. We announced Fluent as a customer earlier this year. We serve health insurers with individual, commercial, Medicare, Medicaid, dental, TPA, pretty much across the entire spectrum of different lines of business. We're located, our headquarters is in Burlington, Massachusetts, outside of Boston, and yes, we are getting snow tonight. We've also got a major office in Ohio, and as you can see, a couple of these numbers are actually a little bit out of date. We're near 10 million covered lives, and we've got about 450 employees. We've won a number of awards and patents, and our flagship solution is a core administration system that serves billing, enrollment, claims processing, claims adjudication, data warehouse, analytics, business intelligence, and integration and connections to pretty much all of the IT ecosystem applications that you would find in a typical payer environment. So that'll kind of give you a quick snapshot of HealthEdge. Next slide, Ed.
Thank you, Harry. And now we have time for the first polling question of today's webinar. We'll go ahead and bring the polling interface up for the attendees. What was your most important organizational goal for 2018? We'll leave the poll open for approximately 30 seconds to give everyone in the audience the opportunity to respond to this first polling question. I'd like to thank the audience. I can see already that approximately 20% of our attendees have voted in this first polling question. While the audience is voting, I'll handle one quick operational question that just came in for a few folks who joined a moment or two late. Yes, this webinar is being recorded, and the recording will be made available to you after the broadcast. The rate of response appears to be slowing now, with approximately 50% of the audience having responded to our first polling question. At this time, we'll move to close the polls and bring the results up on the attendees' screen. Harry, it looks as though 41% have responded increased member satisfaction, followed by a three-way split at 18% between lowering costs, improving provider relationships, and shift to value-based models, with a trailing 5% at regulatory compliance.
Thanks, Ed, and thanks to the audience for jumping in. We got a healthy percentage of participants there. Stay tuned because there will be a second polling question coming up shortly. This audience reflects the same results that we have gotten, and you can move to the next slide, Ed, in a significant survey of health plan executives. You can see we touched nearly 75 health plan executives earlier in 2018, and we asked them a series of questions. And the first question was this question about organizational goals for 2018. And our audience results actually mirror almost exactly the results that we obtained from the health plan execs that we talked to. So I can tell you on behalf of HealthEdge and myself that we were surprised somewhat to see that increased member satisfaction came back as the number one priority. And this, again, this group is right in step with the folks that we talk to. The fact that increased member satisfaction comes in number one over lowering costs, I'm sure you will agree with me, is a pretty big shift from past opinions and past viewpoints. Traditionally, health plans saw themselves largely as fiduciary entities where the premiums would come in. Sure, there'd be relationships with the customers, especially if they were employers. The chief relationship is with the provider network and the contracts that sit between those two entities. But in many cases, just the fact that consumers were called members reflects on the viewpoint that many health insurance plans had on their actual customers, the consumers. But now we see this shifting and changing for the better, where health plans are actually thinking about their members and the satisfaction of their members, and they understand that there's a direct relationship between that loyalty retention, and ultimately the success of the health plan. Costs are still a strong number 2, as they were in this audience. Maintaining and improving the relationships with providers is always important. The natural tension that exists between payers and providers is still there. I think both sides are working on breaking down some of the barriers. I think the advent of value-based reimbursements and value-based care is both injecting a new aspect of tension and also the potential for alignment. Looking to increase members and regulatory compliance. I can tell you that the shift to value-based coming in last, and that was true for this group here, was a little bit of a surprise. But again, it's the voice of the market. So we can move on to the next one. Ed, back to you.
Thank you, Harry. And now we have time for our second polling question of today's webinar. We'll go ahead and launch the polling interface one more time. What steps have you taken to overcome organizational challenges and achieve your 2018 goals? As with our previous poll, we'll leave the polling interface open for approximately 30 seconds to allow everyone the opportunity to respond to this second polling question. Also, I'd like to thank the audience. We've received a few questions already through the questions panel. I'd like to encourage our audience today to continue to send us your questions via the questions panel on the side of your screen after this second polling question. We'll respond to your questions at the end of the broadcast during the Q&A period. Harry, it looks as though we have approximately 50% of the audience having responded to our second polling question at this time. And the rate of response is now starting to slow. So at this time, we'll move to close the polls and once again bring the polling results up on the audience's screen for review. Harry, it looks as though modernizing technology to enable resiliency and change was the leader at 36%, followed at 23% by aligning the business and IT teams to common goals, and a split at 18% for transforming business processes to fit the business model and making significant investments in innovation, trailed at a trailing 5% at updating workforce skills to fit our business model.
Okay, thank you, Ed. And thank you again to the participants in the poll. And we can flip to the next slide where we'll show you the results of the same question asked of the 73 health plan executives. And again, this group mirrors the top choice. So congratulations to this group. You are very reflective of what we also got from an even larger sample. So modernize technology in order to enable resiliency to change, and I think that it speaks for itself. There's a recognition that keeping up with the most modern and updated infrastructure and technology is going to provide a competitive advantage in the form of bringing products to market, responding to customer requirements, reconfiguring when regulatory forces come into play, and any other market dynamics that might be lurking around the corner. Things are changing at a faster pace in healthcare. We all know that, and the one-size-fits-all model doesn't work anymore. Now, this group came in with align the business and IT organizations towards common goals, and I think that's great. I think that's a recognition by the listeners here that only by having unified organizational goals can that success that the technology enables actually take place. And the business brings requirements from the outside in, and the IT organization makes sure that the rest of the business, the rest of the organization is ready to serve those requirements. So if they're working independently and in silos, then ultimately the requirements are not going to be met, and either the systems will break down or business folks will be crying into the wilderness and not being heard on behalf of the customers. So great that you had a strong vote there. And then transforming business processes came in third, as it did in our poll that HealthEdge conducted. By the way, the polls that we're going to be sharing with you today were done in association with a third-party survey firm called Servata. They're based in San Francisco. So all of the surveys that we do are anonymous and done through a professional panel by Servata. So I think here by this group, as well as the group that we surveyed, there's a recognition that business processes have to change. That even if you change the technology, even if you change some of the people, and even if you're inputting customer requirements properly, you can't do things internally the same old way. You've got to fit the processes to both the technology and the customer requirements. So great job, group, and Ed, we can move on. Okay, so now we've talked about some of the voice of the market from the health plan side. Let's put our finger on some of the voice of the market from the consumer side, because consumers are getting increasingly vocal. They need to be heard, and they're an important buying force in our world. So let's flip the slide. So HealthEdge also this year, over the summer, conducted a survey of 2,500 consumers. And again, it was done with the third-party firm Servata, so we don't know who these people were. They were all the primary holder of their health insurance, so they were the subscriber for health insurance. We do know that it spanned many ages and cohorts. We asked them who provides their insurance. So there was a healthy dose of people in commercial, some in individual, some in Medicare, some in Medicaid, and a wide variety of people with different kinds of insurance. Oh, and the majority were actually with employer insurance. That's what I was trying to remember. So the first question that we're sharing here, that we believe the results are significant and very important, and this was across all respondents, and we'll get into one of the demographics in just a moment. But across all 2,500 people, we asked, what are the top 3 services that would help most improve your satisfaction level with your health plan? So what services, if it was augmented by your health plan, would boost your satisfaction level? And pick 3. And you can see that there are 3 that stood out from all the rest. More incentives for healthy behaviors, closely followed tools and information to help me understand my benefits, and right behind those 2 was tools and information to help me find less costly care. So help me understand the benefits that I have, provide me incentives for healthy behaviors, and provide navigation for me to find less costly care. So price consciousness, benefit consciousness, and the desire for healthy behaviors. And you can see some of the other results that came in. So helping to find a doctor or a specialist, also understanding my financial responsibility were some of the other contenders, and easier access to my healthcare records. So I think you can take these and you can see the raw numbers of the people that responded to each one of these. So half of the entire 2,500 people said, give me information so I can understand my benefits. Almost the exact same number, more incentives for healthy behaviors, and right behind that, information to help me find less costly care. I think we should all be asking ourselves, are we providing those services? Are we making those services accessible? Are we making those services self-service? Or is there a difficult gate, whether it be a hard-to-navigate website or a multi-layered call center where I have to get this information? How easy is it that we're making it to access these services and this information? So not only do we have it, but can our members get to it? Okay, let's go to the next slide. So we asked a similar question of the same group, and again, this is across all 2,500 respondents. So from the same list, what are the top 3 services that are missing from your health plan? So what is it that you're not getting from your health plan? And across all respondents, number 1, a healthy number 1, was more incentives for healthy behaviors. So what this group of consumers is saying is we want incentives for healthy behaviors from our health insurance company. We don't just want it from our employer, or we don't want it from our provider. We don't want it from a contest. We don't want it from just self-monitoring our Fitbit and the results. We know that some life insurance providers do the same thing and provide incentives for healthy behaviors. But the consumers are speaking loud and clear, saying we want this from our health plans. And right behind that, we want information to find less costly care, and we're not getting it. So we're price conscious, which is a new awareness on the part of health plan consumers, and we want information to understand my benefits. I can tell you that in independent studies, not done by HealthEdge, but by others that are out there in the public domain, which you've probably seen, when J.D. Powers does this survey where they ask people their general satisfaction level with different industries in their lives, and health plans come in lower than every other industry other than cable TV providers. So auto dealers rank higher than health plans. And there's a message there that there's a lot of room for improvement in customer service. So when you break that down into this kind of a question and say to people, what are you not getting from your health plan? Here's a great message for all health plans to take note of. Okay, let's go to the next one. Okay, so now we're going to slice and dice the information just a little bit. So everybody knows that millennials is a very important group. So why are they important? They're important for two reasons. One, they are now the largest demographic segment in the United States. They have surpassed the baby boomers in raw numbers. And number two, while they are not yet the greatest buying power segment, they will be as they grow older, as their income increases, as they buy houses and property and other assets. So they need to be listened to. And as is the water cooler talk, we've got data to back it up that millennials think differently, and most importantly, they buy differently. Millennials typically buy on price and service, and they're willing to get referrals from others. So if you think of Yelp, the Yelp model works in many different industries as far as reviews and the community, speaking out, and those types of opinions are highly valued by millennials, even if they don't know who it is that's providing that input. And then price becomes a very important factor. And then their overall customer or consumer experience, once they purchase the service or the product, they've got a low loyalty quotient. So they'll switch if they can, based on their customer and consumer experience. So when we asked millennials, when we slice out and look at and put under the microscope the millennial population, you can see there was a pretty good chunk of people here in this group. What are the top three services that you are missing from your health plan? Their number one with a bullet is more incentives for healthy behaviors. So this is a very interesting twist because a lot of us think of millennials as thinking of themselves as invincible, where I don't need health insurance, or I'm not going to go to the doctor, or I don't need a lot of expensive healthcare services. On the other hand, they're looking for incentives to stay healthy from their health insurance provider. And again, these are people who have health insurance. So someone who's without insurance would not be represented in this survey. And then right behind that is tools or information to help me find less costly care. And those two are really out front of all the rest. Third is help tools and information to understand my benefits, but it's somewhat behind the other two. So if you think about this very important, very numerous, and soon to be very powerful group, they want incentives from health plans for staying healthy, and they want to find the best price. And they expect their health plan to provide them with that service. Okay, let's go to the next slide. And just in the general headlines out there in the news, and I just picked a few examples, it's being widely reported that on the care side, not only are consumers seeking care differently, but care is starting to be delivered differently. So you can see this information was extracted from a survey last year done by the Employee Benefit Research Institute. And again, age specific, so millennials and Gen Xers, which is the group just a little bit older, the group in between millennials and baby boomers are the Gen Xers. So the folks in their late 30s, early 40s are more likely than baby boomers to say they've used a walk-in clinic. So they're much more receptive to non-traditional types of care. They see it as normal. It's part of their daily life. It may be convenience. It may be cost. This survey doesn't really get into it, but there's an age distinction here. And as I was saying a minute ago, millennials are much more likely than baby boomers and Gen Xers to shop and to look at reviews and to do comparison shopping and use cost information. And they're going to check on the benefits for things like medications. Even though, again, we think of them as thinking of themselves as invincible, they're actually looking at these things. They're very price conscious. They're going to shop. And then the last piece is about telemedicine. And telemedicine is in the headlines all the time. I actually saw a story from Becker's Hospital Review this morning that of the telemedicine services that are being utilized, about 2/3 are being served to urban patients in urban settings, and only 1/3 to patients in rural settings. So I'm not sure what the reason is there. The news article didn't dive into the causes of this. It could still be about accessibility in rural settings, but I found it encouraging that telemedicine is being used in urban settings, because theoretically in urban settings there's better access to specialists and some of the care that's often delivered through telemedicine. So if you throw the telehealth, telemedicine word out into a room of doctors, it's like yelling fire in a crowded theater. You're going to get a fairly strong reaction, but obviously from all the indications of access, dealing with social determinants of health, and some of the other environmental barriers, telemedicine can certainly open some doors, even though it's still in its early stages. Okay, let's move on to the next slide. So there are other dynamics swirling around us, and we read about them all the time, and there's a lot of conjecture. There's not a lot of tangible results yet. There are a lot of people saying we're making plans. I think one of the notable things is in many of the announcements during the course of 2018 about these new, disruptors, most often the elevator pitch is something around, we're basing this venture on technology. It's most often stated, and that goes along with the results of our first polling question, that modernizing technology to be resilient to change is a key enabler. So it's being recognized by these new folks, even though some of the investments necessary to conquer, the technology frontier are daunting for sure. So let's see what lies behind the slide. So I thought it would be interesting to share with you some information about some of the investments. So some of the biggest technology companies out there are starting to invest in healthcare. And healthcare has been kind of a deep, dark secret for a long time, especially on the infrastructure side. But folks like Microsoft, Google, and others, IBM, are starting to make some very significant inroads, and you can see the number of deals has been rising. And I can tell you I subscribe to another report that talks about how many dollars are invested, and it's in the billions, and it's actually it's well over $3 billion of venture capital money in 2018 so far, with projections that it's going to increase. So I think the message here is, if you think about the first part of this presentation and the clarion call coming from consumers about what they want from their healthcare and health insurance folks, those calls need to be heeded, because if they're not, there's going to be somebody new on the block before you know it, who might have a better value proposition. Let's go to the next slide. So here's a few examples, and I'm sure most of you have seen these. So Amazon is making multiple and diverse investments into healthcare. Couple of things. So they acquired a company called PillPack in June, which is exactly what it sounds like. It's a way of packaging pills into individual packaging, and they decided that this was a consumer-facing application that they wanted. They joined the healthcare venture with J.P. Morgan and Warren Buffett's company. And again, that company has said that they are based on technology, and they're going to serve their 1 million employees differently than anybody has in the past. And we're all waiting and watching to see what they do and whether, if they're even remotely successful, is that a scalable model. Amazon is working on having Alexa serve health applications. Wouldn't that be great? And they openly sell medical supplies, so they're in the market today in many different ways. And we know Amazon picks industries to disrupt, goes in, and very often turns things upside down. So it bears watching. The company that's maybe investing more than anybody is Alphabet. Alphabet is the parent company of Google. So I would urge everybody to keep their antenna up on what Alphabet is doing. And you can see some of the logos of some of their investments on the right, and some of these should be very familiar to you. So Flatiron comes from our area, 23andMe is the genetic testing, and you can see some of the others. And just recently, a couple months ago, Alphabet invested $375 million in Oscar. So again, it's all about the technology and about how the money is going to be used, but some of the mainstream, quote unquote, technology companies are making big bets in healthcare. Okay, let's see what's next. Okay, so back to the HealthEdge Servata consumer survey. So if this is more about the macro marketplace, and we asked of a question that you could look at as somewhat controversial, but we asked, which of the following stakeholders do you believe is most responsible for the high cost of healthcare? Everybody agrees healthcare is too costly. It's running at about 18% of U.S. GDP. That is unsustainable, and outcomes are not making progress. So the life expectancy in the U.S. is actually decreasing right now across all genders and demographics, and the infant mortality rate in the U.S. is actually going up. So we're, if you look at it from a pure cost-benefit standpoint, we are not getting the return for the huge investment. So we asked these consumers, who do you believe is most to blame for the high cost? So not surprisingly, across all 2,500 people that were surveyed, the pharmaceutical companies came out first. But take note, health plan folks, health insurance companies is a very, very strong second. So that means that we're all in the bullseye in the health plan market. Sure, Big Pharma gets the big tag. Big Pharma's in the news every day, the opioid crisis, Medicare, Medicaid fraud, overnight, the whole EpiPen episode and others that get national headlines with prices going up, but very close behind. So nearly 800 people pointed the finger at the health insurance companies. And after that, hospitals came in, a fairly distant third, and then doctors behind that, and then, of course, very few people named consumers because we were asking consumers. So let's go to the next slide, and to me, this could be the biggest wake-up call in the entire presentation for this afternoon. When we asked millennials, which of the following factors do you believe is most responsible for the high cost of healthcare? Look who's number one, health insurance companies. So couple that with the earlier evidence we saw about the missing services for healthy incentives for healthy behaviors, for help understanding my benefits, and help getting me less costly care. This is the message from the millennial population to the healthcare companies. You are not providing me with the services that I need. I'm blaming you for high costs, more so than the pharma companies, which probably there's probably a direct correlation there because probably fewer of the millennials have a lot of chronic conditions that require a lot of medications. But regardless of the reason, to me, this is a very compelling outcome of the survey. So I would say there's a message about the services and about the requirements from the millennial population that comes out loud and clear. Okay, let's go to the next one. So just a very quick one example. I wanted to share one example. This is Independent Health. They are a HealthEdge customer. They are located in Buffalo, New York, and they have a combination of lines of business. They have commercial, they have Medicare, they have Medicaid. They realized probably about 7 or 8 years ago, that they needed to transform their business. They were not only looking for lower administration costs and higher efficiency, but they also understood the coming wave of value-based reimbursements very early on. So they not only rehabbed their entire core administration infrastructure and everything that went with it, they also redid their provider network. And they decided that alignment with primary care physicians was the most important component of that strategy. So they had some very tough conversations with their providers. They set down basically the rules, and they actually lost a lot of providers that they had done business with who were not performing the way that they wanted. And they set up value-based contracts where today, amazingly, 98% of their PCPs are in capitation contracts. So there, you could look at them as an industry leader. That's a fairly radical position in business. And as a result, they've, through the tough conversations, through the tough times, through the renegotiation of contracts, but through the realization that this model works for both the health plan and for the providers, they've got true alignment with their provider network. They've also set up some subsidiary companies to carry on some of the community work and alignment with other resources. They can point to specific ROI for changing over to pay for value, both in terms of lowered costs and also patient outcomes. They're very proud of their reputation. They have a lot of testimonials. They've got a very loyal customer base. They're very proud members of the Greater Buffalo community. And there's true engagement, which is something that everyone seeks among the members, the employers, the providers, the hospitals, and Independent Health. It's a great success story. We've got more information on our website if you're interested, with the full case study and video of Dave Micah, who's in charge of their claims operations, telling the story. Okay, let's go to the next slide. So just one more third-party piece of information that I thought would be important to share. So Gartner, if you're a subscriber, then you have direct access to this information. If you're not a subscriber, then we've got a few quotes to share with you. So the first one is pretty self-explanatory. Gartner is talking about the imperative to digitally transform, and this goes back to the things on the mind of you, the health plan executives, the things that came out of the survey, and the very title of the webinar about digital transformation. So Gartner is saying that a legacy system doesn't have a place in a long-term strategy for a CIO for modernization. It goes back to that modernizing technology answer that came in first among our group here today and also in the survey that we did. CIOs who want to modernize must demand next-gen solutions so they can cost-effectively support the organization and push forward digital initiatives. Okay, let's go to the next one. And Gartner has cited HealthEdge multiple times in what they call their hype cycle report as a next-generation core administration system. They have compelled us to say the things on the right, that we are a leader in this area. And we've got a number of examples, again, that we can share with you through any kind of contact and through the website about leading health plans that have chosen to transform using some of our technology and our services. So we've got some proven examples, and I think the common thread among those health plans is that they are resilient to change. They have embraced rather than run from some of the market dynamics, things like value-based reimbursement, things like the rise of consumerism, things like making sure that services are provided in a digital manner, as we've been talking about for the last 40 minutes or so. You all voted very highly to bring business and IT teams together, and you can see that's a bullet here on the slide. So again, we have examples of health plan customers that successfully bring the business requirements into the IT ecosystem in order to provide products with speed and agility that meet the needs of the consumers. Okay, let's go to the next one.
Thank you, Harry. And now we have time for attendee questions. A number of questions have come in during the webinar. Harry, we have a question that relates to the survey results that you discussed earlier. An attendee is asking, what are some of the other age cohorts not presented in the HealthEdge survey results slides looking for from their health insurers?
Sure. Thanks, Ed. That's a good question. We did provide the results across the entire sample, and then we zeroed in on millennials just in the interest of time. But I can tell you that if you look at some of the older cohorts, and they are large in numbers, the baby boomers, the Medicare customers, and the Medicaid customers, when they talked about the services that were most important to them and the ones that, were potentially missing, the cost of care bubbled to the top, which is not surprising. Many of those folks are on fixed incomes or retirement nest eggs. Understanding my benefits was a strong second among those groups. Again, not surprising that those folks need to understand their benefits in order to know when there might be an out-of-pocket instance and what they're entitled to for reimbursement. And then third was easier access to health records, which is a little different from the other groups, but also understandable in that those folks want to look at their entire history. And then healthy behaviors was still in the mix, but came in fourth among those respondents. So thank you for raising that question. That hopefully helps round out the story.
Thanks, Harry. We have another question here. It looks as though it's on consumer requirements. The attendee is asking, how are providers being impacted by the new wave of consumer requirements?
So that's interesting. That's a different angle. Providers are in a very unique and wonderful position. They sit between the consumers and the payers, and they have influence in both directions. So, if you think about your annual physical, hopefully your PCP is talking to you about healthy behaviors. Hopefully that person is helping you schedule whatever tests you might need. If you have chronic conditions, and we know that more than half of the American population has at least one chronic condition, and about a third have two or more. So there's a high likelihood that the management of chronic conditions falls largely on the provider. The health plan can provide services, can provide guidance in many forms, including, a care plan, care management services, but the provider remains the closest one to the consumers. So if you think about the example I used a moment ago with independent health is creating contractual arrangements with their PCPs to influence the behavior of the PCPs and ultimately influence the outcomes of the patients. So providers are in a vital spot in the continuum between health plans and their consumer customers.
Thank you, Harry. We have another question that's come in relating to cost cutting. The attendee asks, what are some of the measures being taken by health insurers to work with consumers to cut costs? The attendee goes on to comment that Anthem in particular has been making headlines.
That's for sure. So Anthem is probably out front in this area. Anthem recently announced that they were going to deny claims for what they deemed unnecessary visits to the emergency room. It's meeting with a lot of controversy, but I think those who are choosing not to comment publicly may be throwing confetti and saying, yeah, it's finally time to do this. So They're not doing it completely unilaterally. They're announcing these policies. They're educating people. They're trying to provide alternative, means for accessing care. The advent of urgent care, and walk-in clinics. So Anthem really wants their members to think long and hard before they go to an emergency room and use that as their primary care. Think about, a less costly alternative in a walk-in clinic or an urgent care clinic. So this is a trend that is starting to develop. I believe that other health plans are watching carefully and will probably follow suit. But the fact is that there are alternative ways to access service that are less costly, that can still keep patient outcomes, very high, and customer satisfaction very high as well.
Thank you, Harry. We have another question that's come in on the consumer behavior side. The attendee asks, how do health insurers see the connection between consumer behavior and outcomes?
Great. I think we can turn to our audience for the answer, and I think in many ways they've already provided the answer. The call for healthy behaviors and incentives, the ability to provide guidance in preventative measures, so incenting people to take care of themselves. And the fact is the consumers want that incentive. That's the connection. So there'll be lowered costs as well as better patient outcomes, with the embracing of healthy behaviors, embracing of the incentives that lead to improved outcomes and healthier folks.
Thank you, Harry. And we do have, I think, time for one more question. The attendee is asking, how do you integrate customers' experience with providers? There are challenges in sharing IT platform and sharing information.
No doubt. The questioner put their finger right on a key issue. It's interoperability. And it's an age-old challenge. So Seema Verma, who's the administrator of CMS, recently made a major policy speech saying we have got to address interoperability across the entire spectrum. So I took that as notable because the government has put their toe in the water in the past, but not really come whole hog at it. And usually CMS is fairly successful in setting some trends that impact not only government programs, but bleed over to the commercial programs as well. I would point again to the independent health example. So independent health has figured out ways to share data and critical metrics on performance with their provider network in order to make sure everyone's aligned and understands how they're doing against established goals and how much they're going to get paid for. So it's work in the trenches. It's not easy. It's figuring out what the key metrics are and what form of data is consumable by the providers so that they can influence the customer behaviors and the outcomes. So thank you for that question. That was right on.
Thank you, Harry. And with that question, we'll bring the Q&A portion of today's broadcast to a conclusion. And at this time, we'll turn the presentation back over to Harris.
And a good combination, Ed, of Harry and Ferris. First of all, Harry and Ed, we really appreciate the insights, the polling on this webinar, and the research and experience that you presented. I personally have been enlightened and have a number of thoughts that will continue these conversations in the future. And to each of you on the call, we thank you for your time and your interest and participation. Just a couple of closing slides. As you see on the slide with the Nashville skyline, in ongoing support of HCG's theme of guiding healthcare executives through innovation, change, and growth, we will be having an executive leadership, luncheon and roundtable immediately following AHIP's Consumer and Digital Health Forum in Nashville. Our roundtable will be on December 13th. at 1 o'clock. And we'll bring together a panel from J.P. Morgan, from one of our member plans, Independent Blue Cross, Brian Lobley, and other industry thought leaders to contribute their perspectives on these top two issues. They will discuss the tools and the services used to enhance member and patient engagement, approaches for turning passive patients into active healthcare consumers, as we talked today, and how that connects to value-based relationships, not just payers and providers, but including consumers, and what those relationships demand as healthcare stakeholders engage differently with the members and patients than we have in the past. Next slide, Ed. For a complimentary registration to HCG's roundtable and discussion, email Juliana Ruiz at jr@hcg.org, or you can go to our website that's shown there on the slide and register at hcg.org. If you want to attend the AHIP CDF forum, we do have a discount code that we're sharing on this call. You can register using the word HCEG, and as you register, that will get you a discount. Thank you again to HealthEdge for this webinar, and to each of you for participating in this discussion and the great questions that you provided. We hope you have a great day and hope to cross paths with you sometime soon. Thanks, and have a good day.